Drug dependence is a very complex set of behaviours. Generally, the ordinary public tends to try and divide it into two different aspects. I mean, the first aspect is that there is a physical dependence, and then the second aspect is that there might be a psychological dependence. Now, this is very unhelpful because people generally perceive something that when somebody is psychologically dependent on it, it's that it's not such a big problem. Whereas if someone was physically dependent on it, that is, that they are suffering physically, this is a much more serious problem. Now, in my experience, addiction actually is a combination of the two, that you don't get one without the other. And then last of all, that actually once they've stopped using the substances, they go back, if they ever use it again, they will go back to square one, that they will be using it in this sort of compulsive way. Let me talk about the over-the-counter drugs that might be misused. I mean, the most common one, which is an antihistamine, and it's used by lots of people to help them to sleep. And unfortunately, people do become dependent on it. And this is quite a hidden population. It involves a lot of elderly people, and we don't know the real statistics of this. Other drugs that are also bought over the counter are drugs that contain codeine. And this has become more and more of a problem over the last few years. People usually buy simple painkillers, simple analgesics such as paracetamol, and then find that it doesn't work. And will go and talk to the pharmacist, and the pharmacist gives them a combination. So they take paracetamol as well as codeine in a combination. And this obviously can lead to all sorts of problems. The manufacturers of these substances are aware of the risks, and if you look at the blurb that's contained in the packet, it does contain warnings about dependence as well as warnings about taking too much of the drug because it does cause other side effects. They also sell it in packets of 32, so if people do become dependent, they are forced then into other behaviours which might alert people that they are becoming addicted to it. And then, of course, last of all, we find that people also tend to misuse cough mixtures, which contains codeine linctors, and cough mixture contains, I think, 15 milligrams of codeine in every teaspoonful of the liquid that you take. So again, all of these codeine-based medicines can lead people to develop a dependence on opioids, which is the same group of drugs as heroin. It's no different. And obviously, if you become addicted to that, you will require to be treated. Well, the effects of addiction on people's health really depends on what one gets addicted to. And what I'll do is I'll talk about initially the problems that might result from becoming addicted. So you have to take a lot of tablets to get the full effect that you desire after a while. So that's why you start having to take 20 to 50 tablets a day. When you're up to that dose, you start getting two sorts of problems. One of the problems is as a result of the addiction itself, and the other problem is as a result of the side effects of taking too much ibuprofen. Now, ibuprofen is actually only sold over the counter, and you're only supposed to take between 6 and 8 tablets, 200 milligrams in each tablet per day. If you go beyond that, you're more likely to suffer from side effects. Now, people who are taking large doses of ibuprofen will start finding that it irritates the lining of the stomach, and they develop what's known as gastric erosions, and can go on and develop stomach ulcers, as well as irritation of other parts of the gut. If the person doesn't disclose to the doctor treating them that they're taking a lot of ibuprofen, and they might not do that because they're ashamed of doing it, the proper diagnosis isn't reached. When they're taking large amounts of codeine, obviously, it's going to cause them to become drowsy. So there'll be a risk when they're driving their cars during the day, or if they're involved in managing heavy machinery, or if they drink some alcohol with it, that they will actually become more intoxicated than they anticipated. So there's a risk of that. If I can address one of the most common problems they have, and that is that might occur in the practice, and that is perhaps a dependence on benzodiazepines. I mean, these drugs were usually initially prescribed when patients became anxious, and the anxiety goes with depression. So if someone presents with depression, they'll get prescribed an antidepressant and perhaps an anxiolytic such as diazepam or lorazepam. Or alternatively, the more common thing to happen is that people complain of insomnia, and the GP might prescribe temazepam to help them to sleep. And this is a very effective short-acting hypnotic. Now, initially, the person might be taking a number of different drugs, and the GP doesn't become aware that the person's been taking it for an extended period of time. The index of suspicion should be raised when the patient comes and says, look, the tablets ain't working as well as it did. And when that happens, the GPs are faced with a dilemma. It's, is this because the illness has become worse, or is it because the person's developed a tolerance? And what happens is the GP says, okay, we'll increase the dose, and lo and behold, it does work. And of course, you're still in the dark as to whether this has worked because of the effect of tolerance, or whether it's because the anxiety symptoms have become worse. The patient feels very comfortable taking this, and after a while develops a sort of dependence. I can't do without this drug. So they will perhaps learn to say the right things to the GP to encourage the continual prescription of this drug. And after a while, the person will then start finding that actually I'm taking more than what the GP is now prescribing, that instead of it being 5 milligrams 3 times a day, it's now getting up to 10 milligrams 4 times a day, which is 10 milligrams more than what I'm supposed to be taking. And the patients can do a number of different things. Sometimes they might be able to obtain more diazepam from granny, or they start turning up at the surgery to have a newer prescription issued to them. So they're returning for their further prescription much sooner than normal. Now, initially, this is perhaps just a few days early, and then it becomes a week early, and the GP might start noticing that the person's using various excuses. I'm going on holiday next week, doctor. Could you give me a prescription to just cover me? I'm going to visit Granny up in Newcastle for a month. She's unwell. Could you give me a prescription of medication to cover me? And sometimes doctors don't actually record the excuses. It's the old joke about, but I thought your granny died so many times before that. And you need to keep a record of what is happening. Nowadays, of course, with computerized records, it is much easier to see and spot trends. And I know that GPs do audit each other with regards to their prescribing habits, and I'm sure that with modern sort of computerized prescription generation, this sort of thing will be much easier to pick up. Priory is very much aware that when people telephone, they might well be in crisis. So the important thing is actually to respond to that request for help as quickly as possible. Priory actually offers a free first initial consultation, and this is done by a trained counsellor. The trained counsellor obviously is very much aware of the possible psychological state the person might be in coming to see them. So the person's interviewed initially in a very sensitive way by a trained counsellor who is very much aware of the various defences the person might have, because often people will minimise the extent of their addiction. The trained counsellor will also interview any relatives at the same time to get a clearer picture of what is going on, because sometimes you don't get the whole truth. And by finding out from the relative what they've perceived to be the problem, you get a clearer picture of this. The interview is very sensitive. And at the end of it, the trained counsellor will be able to tell them that what the problem is, if there's and what sort of help they might be able to access. So the initial phase of treatment offered by the Priory is really to do with a medically assisted withdrawal. And then they go on to do the Priory Addictions Programme. But if they require any other treatments, then bits of other treatment programs can be bolted onto the main thrust of what they might be coming in for. During the time they are doing the program, they might well have one-to-one therapy. They will also have relaxation sessions, and gym sessions to try and get them to take a break from the intensive treatment that they're having. And it is quite intensive. People have this perhaps misconception that coming into doing the Priory program, it's a bit of a holiday camp. But in fact, most patients report that they feel very tired with all the therapy that happens, and they work extremely hard in therapy.